Hey there, and welcome. Today, we're going to break down what is, honestly, the fundamental operating system for every single nurse out there, the nursing process. Think of it as the critical thinking framework, the playbook, that guides every decision and every single action in patient care. So let's dive in and see how it all works. So let me start by asking you a question. What do you think is a nurse's most powerful tool? I mean, is it some fancy high-tech monitor, a life-saving medication? Maybe it's the stethoscope? Well, the answer might actually surprise you. It's none of those things. It's not a piece of equipment at all. The most powerful tool a nurse has is a way of thinking. It's a structured approach they use to solve patient problems. And that way of thinking, it has a name. It's called the nursing process. Now, the official definition calls it a systematic, organized framework. But, what does that really mean when you're actually with a patient?
Well, think of it like this. You can't just skip high school and decide to show up for your first day of college, right? It doesn't work that way. You have to complete the steps in order. The nursing process is exactly the same. It's a system with 5 clear stages, and you absolutely cannot skip one to get to the next.
All right, so first up, let's take a look at the basic blueprint of this process and really understand what makes it so powerful. At its heart, the process really has 4 main goals. First, you've got to identify the patient's health problems, both the ones they have now and the ones they might have later. Then you create a solid plan to take care of those problems. Next, you deliver the actual care, those nursing interventions, to make the plan happen. And finally, you have to check your work. You evaluate whether or not it all worked. Now, beyond those goals, the process has some really key characteristics. Yeah, it's systematic and goal-directed for sure, but here's what's so crucial to get. It's also dynamic and cyclic. This is not a one-and-done task. It's a constant loop that changes right along with the patient. And the beauty of it is that it's universally applicable. It doesn't matter if you're in pediatrics or geriatrics, a hospital or out in the community, this process works. So, how does this whole thing get started? Well, it all begins with step 1, assessment. This is the foundation, the part where you're a detective gathering all the critical information. During an assessment, you're on the hunt for 2 types of data. First, you have subjective data. Think S for what the patient says. It's their symptoms, their feelings, like when they tell you, "My chest hurts." Then you have objective data. Think O for what you observe. This is stuff you can measure and see for yourself. Things like blood pressure, lab results, or noticing their skin is pale. One is what you're told, the other is what you can prove. And to get that objective data, nurses have 4 classic techniques in their toolkit. There's inspection, which is just a fancy word for careful looking and observation. Palpation, which is using touch to feel for things like swelling. Percussion is that precise tapping you might see to hear sounds from inside the body. And of course, auscultation, which is listening, usually with a stethoscope. And right here, you can see 2 of those techniques in action. On the left, that's percussion, tapping on a patient's back to check out their lungs. And on the right, you've got auscultation, using that stethoscope to listen to breath sounds. It's all about using multiple senses to build a full, complete picture of what's going on. Okay, so you've gathered all your data, you've collected your clues. Now you move into the second step, diagnosis. This is where you put on your analyst hat and figure out the patient's key problems based on that evidence. Now, this is really important. A nursing diagnosis isn't just a single word like pain. No, it's a full statement, and it's built using a specific 3-part formula. First, you state the problem. Then, you connect it to its cause using the phrase related to. And finally, you back it all up with the evidence, the signs and symptoms, using the phrase as evidenced by.
Let me give you a perfect example. The problem is acute pain. What's the cause? It's related to the surgical incision. And what's your proof? It's evidenced by the patient grimacing and reporting a pain level of 8 out of 10. See how that formula creates a complete, really clear picture of what's wrong? It's not just pain. It's a specific problem with a cause and evidence.
So, with that super clear diagnosis, it's time for step 3, planning. This is where you lay out the roadmap for the patient's care.
Building the care plan is a really logical process. First, you have to prioritize. What's the most important problem to tackle right now? Then, you define your expected outcomes. What's our goal here? What do we want to happen? After that, you pick the specific nursing actions or interventions that will get you to that goal. And finally, you write it all down and record the plan.
Now,
When setting those goals, nurses use a fantastic acronym, SMART. This makes sure the goals aren't just vague wishes, but are actual, concrete targets. They have to be specific, measurable, achievable, realistic, and have a time frame. This is how you know for sure if your plan is actually working.
And now we get to the part where the rubber meets the road. We're covering the last two steps, implementation and evaluation. This is where the plan truly comes to life.
Step 4, implementation, is pretty much exactly what it sounds like. It's the doing phase. This is when you put your plan into motion. You carry out all those interventions you chose, whether it's giving a medication, changing a wound dressing, or teaching the patient about their health.
And last, but definitely not least, we have Step 5, evaluation. After you've taken action, you have to circle back and check your work. You have to ask the big question, did it work? And to find out, you compare the patient's actual progress directly against those SMART goals you set way back in the planning stage.
The evaluation is only going to give you one of 3 results. Number 1, the goal was met. Awesome. Problem solved. 2, the goal was partially met. Okay, some progress was made, but there's still more to do. Or 3, the goal was not met at all. And that result tells you it's time to rethink the plan.
And that last point, revising the plan, that brings us to the final and honestly the most important insight about the nursing process. It's not a straight line.
Remember way back when we said the process was cyclic and dynamic? Well, this is exactly what we meant. The 5 steps actually form a continuous loop. The information you get from your evaluation feeds directly back into a brand new assessment. If a goal wasn't met, you don't just throw up your hands and stop. No way. You start the whole process over. You reassess, you rediagnose, you replan, and you try something new. Patient care is never, ever static.
Which really leaves us with one final thought to ponder. If this whole process is a constant, looping conversation between what a nurse does and how a patient responds, well, when does that conversation ever truly end?